Hello, everyone. This is Dr. Carrie Bedient with the Fertility Center of Las Vegas, starting off another episode of Fertility Docs Uncensored. And I am joined by my two sizzling hot, because the weather is freaking hot right now,
Yes.
co-hosts,
Amen.
Dr. Abby Eblen, who looks delightfully refreshed in a beautiful pink and red flowery shirt. And she just looks so lovely, like she is a
It's
bloom
a really
in the
pretty
middle of the
shirt.
summer.
Thank you, Carrie. Hi, everybody. Great to be here.
And then also joined by Dr. Susan Hudson, who is our lovely, sprouting, flowery, delightful Texas partner.
Hello, it's hot as hell here too.
Yeah, I'm melting. And today we are joined by Ryan Woodbury, and we'll talk a little bit more about all of her, credentials and her stuff in a minute. But the short list is she is a holistic nutritionist, and she's a CEO and co-founder of Needed, and we'll go into that in a minute. But Ryan, you were telling us that you have been working from a young age, and you had a job in middle school that the three of us, I don't think, had ever considered that someone would have, particularly not a middle
In
schooler.
middle school, yeah, that's what's so
Mhm.
interesting too.
Yeah, I was so my first job, if you look back, I worked in an aquarium for a couple of years in middle school, cleaning fish tanks and helping with kids' educational tours. And I was, a super outdoorsy kid, loved the beach, loved the ocean. So it was a delight, I think, as a kid to be there. And I think really kicked off like an interest in kind of environmental related issues that ultimately led me to an interest in human health, because I believe like environmental and human health are so interconnected, and realized I got a lot of people to care about some of the esoteric marine science things that I liked through making the connection to, human health.
So what was one of the coolest things that you did at the aquarium?
Probably, I got to go out with the head aquarist scuba diving on a couple of occasions to actually pick up samples of
That's pretty darn cool when you're in middle
different-
school.
of different I guess animals and plants for the aquarium. So
That's
we would
cool.
actually, the aquarium showcased everything that was in the Santa Monica Bay, and everything was kind of harvested from there as well. So that was a pretty cool way to spend a work day.
So when you go to aquariums now, do you kind of look at it with a critical eye of, oh, I bet I know where they got this plant or that fish, or I know why they put these fish together?
I wish I had retained more of the like specific information. I brought my daughter to the aquarium I used to work at a couple months ago, and my husband was quizzing me on different things, and I was like, oh gosh, like I don't remember the name of this fish. Like I used to know, but it's just like it's not there anymore.
A lot of other important information has replaced that information now.
Yeah.
All right. Well, fish aside, Susan, do you have questions for today?
We do. We got a couple of them. Okay, so our first one is, hi, Fertility Docs. My wife and I love your podcast and can't thank you enough for all you do. We've recently had 2 unsuccessful IUI cycles with donor sperm, letrozole, and ultrasound monitoring. We're wondering if our RE is missing the ideal timing. In both cycles, my wife's follicle measured 15 to 17 millimeters during a mid-cycle ultrasound, but she was told to no trigger for several more days, so her follicle would measure around 29 to 30 millimeters. From doing some reading, it seems like this follicle may be, quote, overmature or otherwise not ideal. What do you think? Should we be triggering earlier? Is there such a thing as a follicle that is too big? Thanks again.
I just worry that if you waited 2 or 3 days, that 15 to 17 millimeter follicle may have already released. So I would say, I think the 3 of us would probably bring you in, look with ultrasound, and check and see what the size of the follicle was. And if it wasn't ideal, maybe bring you back the next day or 2 days at most later, because you just worry if you wait too long, you're going to release the egg and it's going to be out of the window that it can be fertilized.
When you go to the question about overmaturity, a lot of overmaturity discussions come from IVF when follicles got really big and they saw decreased pregnancy rates. But that was also with only fresh transfers, and that is a different environment than when you do it with a frozen transfer. So when you separate that out, we find that it's really hard to get over mature follicles, even with IVF. And with IUI, let's say you are waiting too long to trigger, your body is going to trigger itself. And so you will have that positive feedback system that kicks in the hormones that signal ovulation. And so it may mean that you miss the window, but you're not going to have a post-mature egg as a result of it. You're just going to miss the window.
Yeah. I mean, this question, I think, is specifically looking at, donor sperm IUI. And so the fact that you're really not going to have sperm exposure except for the moment of your insemination, I would be concerned that, just like Carrie said, that you're actually ovulating sometime between the time of your ultrasound and the time that you're actually getting there. I mean, I would think that most people would consider somewhere between 18 to 24 millimeters. I mean, and that's a 6 millimeter difference, but somewhere in there, you're going to have a pretty darn good chance of having a mature egg, and waiting until 30 is, I think that's stretching it, especially for someone who has unique sperm exposure to the IUI.
Mm-hmm. And using ovulation predictor kits sometimes is a way to bridge that gap, because if you discover it's positive, you call your clinic that day and get in usually the next day for the IUI, and that can save the timing a little bit more. All right. What's our next question?
One more. Hi, thank you for your amazing podcast. It is so informative and helpful. My right tube is blocked, but all other tests came back good for myself and my husband. We started the first round of IUI only for it to be canceled. I took 5 days of Clomid, and at the ultrasound after the meds, I only had one follicle on the left at 12 millimeters. I came back 2 days later, and it was the exact same. My doc canceled the cycle and didn't want to do more meds because I have a factor V Leiden and was worried about blood clotting. I am going in for a progesterone test this week to see if I ovulated at all. Do you think I can stick with IUI if I am ovulating, or do we have a better chance with IVF? Thank you so much.
So the answer is yes and yes to both those questions. Yes, I think you can stick with IUI, and yes, I think you will have a better chance with IVF. But they're not necessarily related. And so, we've talked ad nauseum about the success rate differences between those two things. And so, yeah, your success rate probably is higher with IVF if you're looking at 1-for-1. But if you want to keep trying, there's other medication combinations you can use, and you may be able to go up on the dose depending on what dose of med you started on. And different people handle it different ways. Sometimes they'll bump up the dose immediately. Sometimes we have to wait and get a period to let things reset. But, I think you can give it a shot. I mean, not knowing all the details, but it seems reasonable to me.
Yeah, and with the factor V Leiden issue, one thing I would think about is maybe, and everybody handles this a little differently as well, but if you've never really had a deep venous thrombosis or clot, I usually just put patients on 81 milligrams of aspirin. Unless you ovulate, your estrogen is really not going to bump up significantly or that significantly high that we probably have to worry about clotting. And so the argument to bump you up on your dosage wouldn't be that we think it's going to increase your clotting risk, because you got to have an egg ready and you've got to ovulate. And so if you don't ovulate, your estrogen level is not going to be very high. So I think putting you on 81 milligrams of aspirin would be perfectly fine. And if you want to continue on Clomid, I would bump you up to, 1 pill, 2 pills, and then, potentially 3 pills and even more if you need that.
And even considering, I mean, like Abby said, just a history of factor V Leiden without a personal history of clot really is relatively inconsequential. I mean, we care, and it's good for us to be aware of it. And yes, you're at a higher risk than the average person, but still the likelihood of there being an issue is pretty low. And again, our goal is to get you pregnant, which your state in pregnancy of risk of clotting is going to be a lot more than anything we're ever going to do in an IUI cycle. And so maybe considering, instead of Clomid, maybe switching to something like letrozole, where we help keep your estrogen levels down. You can use letrozole with a little gonadotropin to kind of bump things up, but your doctor's going to have to push it a little bit, because
at some point,
we got to get an egg mature, and that mature egg is going to produce estrogen. And so we have to go in that direction. So I would keep on going, if otherwise we have otherwise good factors, I think IUI has a reasonable chance. But just like Carrie said, IVF is always going to give you a better chance, but it's the right thing for some people. It's not the right thing for others.
Totally agree. All right. So Susan and Abby and I are really excited about this topic for purely selfish reasons. And so we are joined today by, as I said, Ryan Woodbury, who is the co-founder and CEO of Needed. And her background is as a holistic nutritionist. And so whenever we have a guest who has the ability to speak to some of the pharmaceutical stuff that we do, we just eat it up because we get the training, but you tend to know a lot more of the details. So today we're going to focus more on prenatal vitamins. And so tell us a little bit about how you got where you are now, and then we'll start diving into details about vitamins.
Yeah, absolutely. So I guess the quick summary is you heard on, first job related end of things, longtime interest in environmental and marine science. I thought I was going to go somewhere in that direction. I studied environmental science in school, started with a little bit more of a marine angle, but it ended up moving into food systems. So a lot of work around regenerative agriculture and teaching kids about nutrition through school-based farming classes effectively. Ended up spending some time in finance thereafter. Long story of,
very different track there, huh?
Very different
a
track.
lot of professors that they were really not happy that that's the path I went from environmental science to,
from one grain to another grain.
Yeah.
Yeah. But ended up, I think, really, going to grad school to get back to kind of closer human health and environmental health related initiatives. Met my co-founder, Julie. We were next door neighbors our first year of business school. And both of us connected around sort of longtime kindred spirits, effectively, that even though we'd been, working in finance, we were spending most of our time on the side doing extra nutritional trainings and things like that. And we were beginning to think about motherhood. And we're optimizers when it comes to health and nutrition. And I think began just learning everything that we could. And a lot of this started with doing some pretty extensive nutritional testing to really understood where we were at as a baseline, when a lot of that at-home nutritional testing became a lot more accessible. Dr. Carrie, do you have a question?
So I was going to say, when we're looking at the back of a prenatal vitamin bottle, they've got all of the RDAs, the recommended daily amounts, I think. And so where do those numbers come from? Because that's what most of us are looking at.
Mm-hmm.
Yeah, so this is exactly what we uncovered. So the basics was, through this nutritional testing, we were shocked to find that we were hugely deficient nutritionally. And at this point in time, we were taking some supplements here and there, like a standard, whole food spot prenatal, but not doing extensive supplements. But we were doing everything right, at least we thought, food-wise, of farmers market shopping and, eating really high quality things. So we were pretty shocked to find that we were highly nutritionally deficient, not just in a single nutrient, but across a whole host of others. And realized we were far from alone.
So how did you find that out, that you were nutritionally deficient?
Through some pretty extensive nutritional testing. And so both through at-home tests and then working with some naturopathic and functional medicine doctors to run more complex panels once that kind of at-home tests indicated there could be some problems. So went and sought some more expert advice. And really what we saw is that we were far from alone when we dug into the research, that despite 97% of women taking a prenatal during pregnancy, research indicates that 95% of them are nutrient deficient and at least a couple of key nutrients that are critical for an optimally healthy kind of pregnancy for mom and baby.
What are some of those top nutrients?
Omega-3s, choline, magnesium, B12, selenium. The list goes on, but those are the ones that have some of the highest deficiency rates. Oh, and vitamin D as well.
Yeah. Vitamin D is a big one that we see in everybody.
Yeah. Everyone seems to be deficient in vitamin D. There's a lot with vitamin C and a lot with vitamin A. Those aren't as regularly tested, but there's a long list. And effectively, to Dr. Carrie's question, a lot of this we think one of the core problems is that supplements are, for the most part, designed around the RDAs, which is a government standard set back in World War II in the 40s. Wow. Yes, that was World War II. And wanted to date check myself for a second. Really to help kind of make sure soldiers had basic nutritional levels, and they
so
have
not
not
women. Women were not involved. Pregnant women were not involved in those RDAs, is what you're saying.
It was an estimate for pregnant women based off of body size, but they were not heavily involved in setting them, nor was the mindset of like, you know, pregnancy being a heavily nutritionally intensive time of life. It was instead, again, how do you avoid a disease condition? So much more of the like, how do you not get scurvy for vitamin C versus how do you have enough vitamin C such that your like tissue ligaments can be moved enough as your pelvic floor expands during pregnancy and birth, are very different kind of sides of the equation.
Absolutely. So not too many scurvy in this day and age.
We found just the core underlying kind of philosophy to be missing the mark and not what we wanted for our pregnancy. So that, I think, started a self-process of just talking to as many practitioners as we could that knew a lot more about nutrition and just understanding what they were doing instead. And what we found is there were a wide set of practitioners that recognize this deficiency with standard prenatal vitamins, and instead we're recommending much bigger protocols to their patients. But oftentimes these were protocols of, 12 different bottles across 6 different brands. So very clunky and hard for a consumer to reach unless they were working with a very specialized practitioner or they were super sort of dedicated to their nutritional regime.
So with your product, because I was looking at this and I was really interested in this, tell us what your delivery system is. I thought it was really unique the way you guys have designed that.
Yeah. So basically we have our core products, I guess, started with a prenatal multivitamin. We started with a powder, really because a powder that you can blend into smoothies or oatmeal kind of helped showcase the story of it holds the most nutritional kind of levels such that we could get everything that we wanted into that powder. We ended up later creating a capsule version, but it's 8 capsules, which aren't always appealing for everyone. So a lot of it comes down to the education of like, hey, if you want optimal choline amounts or magnesium amounts or calcium amounts, these are very bulky nutrients. And we can promise you if you're taking a 2 capsule prenatal, you're not going to get anywhere close to optimal levels.
So how much liquid do you need to dissolve the amount of powder that you would do? I'm like wondering, like, can you like mix it in with like orange juice or your coffee, or do you have to actually eat something?
We do recommend just with heavy kind of minerals and vitamins that you probably want something else in your stomach versus an empty stomach. So we do recommend eating it with a meal. But let's see, I would say like an 8-ounce glass of like almond milk is what I usually would like. If it's a morning, I don't want to make a smoothie. Like I think it tastes great, like an 8-ounce glass of almond milk. It's vanilla flavored. So I guess for some people an orange juice, maybe it would taste good as sort of like a creamsicle orange. And then I do know in coffee and cream, some will put it in. A lot of people like it in yogurt or oatmeal. I'll mix it in with peanut butter sometimes.
That sounds good.
That sounds pretty flexible for getting it in whatever you can tolerate at any given moment. And
a lot of people find it just like a lot more pleasant than taking capsules and a good solution for, when you're nauseous and other things, and sort of as an alternative of, gummies are very pleasant to take too, but you just can't pack enough nutrition into the matrix, and a lot of certain nutrients like minerals really aren't stable in a gummy matrix, so you're not going to be able to get high enough kind of quantities of some of those important items in a gummy.
I think patients really don't realize, because a lot of times when we see them, or when I see them for their second ultrasound at about 8 weeks, I was mentioned, around 11 or 12 weeks, bone starts to form in your baby, and you really need to make sure you get some calcium because you don't get that in your prenatal vitamin. I haven't met a patient yet who wasn't just dumbfounded. They're like, you mean we don't have calcium in our prenatal vitamin? I mean, you're going to build a baby and build the baby's bones, and you would think that you would have that, but you sort of answered the question. It sounds like it's just too much to pack into just one or two capsules, basically.
Calcium's super bulky. So yeah, it is one of those that often gets left out of prenatals, or it's there in just like a really minute dosage. Like we have 200 milligrams of calcium in ours, and that is only 15% of the daily value. And again, the daily value is rooted in kind of a translation from the RDAs. So it is looking at things from a minimalistic level. And the reason that we only put 200 in ours, and that is a lot higher than other prenatals, but obviously not approaching the full RDA, is because there are limits to how much you can absorb in a single setting. So we wanted to be under those limits, and some, depending if they don't eat enough dairy containing nutrients, could benefit from a second, dosage of calcium at another point in the day.
So how do you check and confirm that all these things you're putting in the prenatal are actually getting absorbed? Because I remember, learning across all the years, like there's only so much of certain things that you can take at one time, because
you're going to pee out the rest.
Yeah. I mean, you pee it out or you poop it out. And so you end up with expensive toilet products, and that's about it. And you're not absorbing it. So how do you make sure that those things get absorbed?
Yeah, it's a great question. So, it's a couple of different areas. One, like we rely heavily on nutrient forms that have good research around their bioavailability, so that they are better absorbed and processed in the body. So this would be like a methylcobalamin for B12 versus a cyanocobalamin, which is a sort of a cheap standard form of B12 that's used. There's better data around methyl kind of getting absorbed and being effective. So going to a lot of that research around absorbability. And then a lot of it is also looking at nutrient pairings. Like currently we do not have iron in our prenatal, which might be something that, again, Abby, to your question about calcium, maybe would be surprising of like, why isn't iron there? But that was because iron competes with other minerals to be absorbed. So you actually don't want to take iron at the same time as calcium or magnesium. So we sell a separate add-on iron product. And then the reason that we picked iron to be held separately versus those other two is that iron can actually be harmful if you take too much of it. And because most pregnant women's iron levels are regularly getting tested, we think it's easier for someone to dose appropriately than magnesium or calcium, which aren't really getting tested. So you can kind of titrate iron up accordingly.
I have to say that one thing I've seen over the last couple of years that makes me real nervous as an OB-GYN is everybody's taking magnesium, and they're taking magnesium for all these reasons. And I'm like, magnesium's used for very certain things in obstetrics. And it just makes me really paranoid. Like,
and is that kind of the magnesium that's unbioavailable that's usually used for loosening bowels? Is that the setting that you're thinking of?
Right. Or they're using it for migraine prevention, or just we're taking some magnesium because we decided to take some magnesium instead of it being in something that's an organized, thought out, like dedicated process.
Yeah. And yes, I think it is helpful to sort of like have some organized thought around sort of anything that you're putting heavily into your body. I think the one thing that is comforting to that regard is that magnesium is so depleted from our soils and our food system that magnesium is one of those nutrients that like pretty much everyone is deficient in at this point in time. And our practitioner base does really see strong benefits for migraines, Charlie horses, a whole host of things for like optimal magnesium levels. So we are a big fan, but magnesium is also one of those nutrients where form really matters because it changes the absorbability of the magnesium pretty significantly. Like you'll see magnesium oxide is basically used as a laxative and sold commercially as a laxative because it's so unbioavailable. So your body really can't break it down and absorb, where other forms, like a magnesium citrate or a magnesium glycinate, can be more readily available. So you can actually get the mag into your system.
So along those same lines, we always get questions about folic acid, folate, L-methylfolate. What type do you have in Needed, and what do you recommend?
Yeah, we recommend methylfolate. And that is what we have in the product. We know that as of right now, ACOG and CDC only recognize folic acid as the only form of folate approved for pregnancy. We disagree with that. A lot of their reasoning is that folic acid is the only one that has been specifically studied to prevent neural tube defects. But there's a bunch of data showing that's implied around how a lot of it is serum folate levels, and methylfolate does a better job at increasing your serum folate levels, so actually having usable folate in the body. And there just hasn't been a research opportunity, I think, to, no one wants to do a placebo kind of controlled study. It makes pregnancy really difficult. We would like to do a retroactive study and have a couple of conversations ongoing in that regard that we think could be interesting. So we're fans of methylfolate, and then we're also very big fans of choline, which is under talked about, but folate works synergistically with choline as part of that early neurotube formation. And choline is another one of those nutrients that is missing or at very, very low dosages in the vast majority of prenatals because it's, again, very bulky.
What do you think about vitamin A and those derivatives? Because that's another thing. As an OBGYN, you worry about the teratogenicity or its impact on birth defects on kids. And I oftentimes see people who come in and they show me, okay, I'm on this and this and this and this. And I look at all of them. And by the time I get up to, what they're taking, it's like 400, 500, 600% of the RDA. And so I'm like, let's scale back on this one and this one and this one and just that one. And so how do you factor that in? What do you guys think about that?
So 2 ways I'd answer that question. So one of the ways is I think we really recommend in pregnancy watching what you're taking across different brands, and it's complicated, but you can load up on nutrient levels to a very unhealthy amount very quickly. And you guys
more is not more, right?
More is not better.
It is not. Folate, for example, is something that we see people taking way too much all the time. And you all probably see this in your fertility space a lot, because a lot of the A quality fertility support supplements have folate in it because of, fertility benefits around folate, but then they're also still taking their prenatal, and many prenatals have folate dose way too high. So they get to these crazy levels, and the way that folate interacts with your serotonin neurotransmitters, it can really lead to pretty significant mood imbalances in women. So it can be scary, and you think of these supplements as being pretty harmless, but they're not in certain occasions. So I think that is an important thing to say. And it's something that we really stress at Needed. And we think about all of our products. We now have almost 30 in a system. I know we don't want to divert too crazily to the other ones, but we want to make sure they work together and that you're not overdosing on any one of them. And
an important thing here is just because it's natural and it's something that's needed, that taking more is not literally something that's needed. That's great. I didn't even try to do that. That there is the potential that you could take too much.
Remember, cyanide and arsenic
we are focused on what is the
natural.
optimal dose, and optimal. You can move away from optimal either with being too little or too much. And vitamin A, to Dr. Carrie's question, is one that we see more often. There's a problem with too little of the active form of vitamin A than not enough. Beta carotene, unfortunately, has 2 problems with it. One, you have to convert it into the active form of vitamin A to be usable by the body, and a lot of people aren't very good at that conversion process. And the second is beta carotene the data increasingly shows it's just really unstable in supplement form. So we don't think it really has a strong shelf life. We do use beta carotene in our product and we try to test it, but we would be uncomfortable with beta carotene alone and want to use a retinol form as well. Be careful about the dosings, but the tetragenic kind of levels are way above anywhere that we dose in the product. And we do think the benefit of having that active or more easily metabolized form outweighs the risk of not having any vitamin A, because it is so critical for early childhood development. But it certainly gets a lot of confusion and a bad rap because you hear more regularly. At some point, people just pay more attention to like maybe the skin products and avoiding all the retinol products than the knowledge of what you're actually ingesting.
So are there vitamin supplements, things that you that your body needs that are just really hard to get? And even when you're on, you know, a good quality supplement or prenatal, that you have to pay attention to, I got to get this in my diet because it's really not well delivered in any other supplement form?
That's a great question. I'm trying to think.
You mentioned selenium.
Selenium, L-seleniumethionine, is the form of selenium that we use, and that actually is really well delivered in supplement form. It's one that's trickier to get through food. I feel like there's only certain food sources that are super high in selenium. You talk about like Brazil nuts and other things. Selenium can be supplemented well. We just think it's a very expensive ingredient. So it's not dosed very high. And I think just awareness of the importance of selenium outside of maybe men and sperm just isn't talked about that much. So I think selenium can be supplemented well. I think a lot, Dr. Carrie, to your question, probably gets less to can it be supplemented, but is it designed in a supplement properly? Like we get nervous in many cases around like CoQ10, probably a nutrient that you hear a lot in the fertility space, or omega-3s being mixed with other nutrients. They are pretty unstable and can oxidize pretty easily. So those are products that we like to be like sold separately on their own versus like we have an egg quality support and a sperm quality support, and then we sell a separate CoQ10 because we couldn't get comfortable with mixing the CoQ10 into those products around maintaining it in a like sort of a non-impacted form.
So what type of quality control do you do on your products?
Yeah,
because that's a big issue nowadays when it comes to supplements. I mean, it's scary. Like
there's no FDA regulation.
There's no FDA regulation. I mean, it was funny because I think like 10 years ago, Consumer Reports essentially came out and was like, yeah, most of those vitamin companies aren't delivering what they think. And then there was a big paper like in the last 6 to 12 months that essentially said that within, you know, kind of published literature circles. So what do you guys do to set yourselves apart?
Yeah, it's a big problem. We do third-party testing on every batch, and consumers can ask for those, like basically C of A results that explain the testing. So when we do more extensive testing than what's recommended, the FDA does not. There are like regulations, there are guidelines for what the supplement industry should follow. It's just not like the pharmaceutical space where there's pre-market approval and regular checks to make sure people are actually following these suggested guidelines. And so it is very much still wild, wild west. Supplements are regulated like more like food effectively than they are like pharmaceuticals. So that allows for a lot of, you know, bad actors and the ability to like what the label says, the actual product, what's underlying doesn't reflect it. And so we use the combo of extensive third-party testing. We hired a quality team very early in our business to stay on top of these things. Basically annual audits and requalifications of our contract manufacturers and ingredient suppliers. And then another kind of helpful bet is our main audience has been, we sell with about 4,000 practitioners who are regularly testing the nutrient levels of their patients. So they let us know that they're actually seeing results.
Is there anything, so two halves to this question. Is there anything that when you're taking any sort of item supplement that you really probably ought not do with it? So for example, don't take iron with anything else you said earlier. Is there anything, calcium containing dairy products, does that have the same effect? Should you avoid those while in the same meal as your vitamins? Like, is there anything like that where you really probably shouldn't put the two of those things together?
Mixing and matching.
Mixing and matching, yeah.
It's a really good question. So for sure, I think where you can, fat soluble nutrients with fatty foods is fats like fats, but for a multivitamin overall, we just recommend taking it with food, and it won't impact the absorption of the water soluble nutrients. Trying to think other rules of thumb. I mean, there's certain things don't want to give exact medical advice, but K2 has blood thinning properties. You want to be careful if you're on any blood thinners. There's some other specific mixes between nutrients and pharmaceuticals. I mean, you don't want to heat your vitamins, so don't bake with them. There's a number of people that, especially our prenatal multi-powder, would love to and it's sweet, make cookies or brownies with it. That's a no-go.
It's a good point.
Yeah. Just use it in the frosting, not the cooked baked good.
Exactly. Actually, I hadn't thought about that, but I think it would be.
Frosting, it's always a good idea, Carrie.
Oh yeah. Frosting would be really good.
That would be delicious. We might need to make some needed prenatal frosted cookies or something.
I would say I can be your consultant for all things sweet.
Or anything chocolate I can help on too.
So it sounds like the main things are make sure you're taking it with some type of food so it's not landing on an empty stomach, and just be aware of what all you're putting in your body at the same time.
What else you're taking, especially if you're buying across brands, to make sure there aren't interactions, or even with certain brands, there can be products that are not intended to take together. But from our assortment, iron is really that one that we want you to take at a separate time, and we kind of lay out those instructions pretty clearly.
Okay, so I have a really off the wall question, but let me tell you where I'm coming from. In our field, a lot of people, if they can't take things orally, if it upsets their stomach, or for some reason they have some systemic response that we're trying to avoid, they know what I'm about to ask. We actually have people take medicine vaginally because it absorbs a lot more quickly. It gets closer to the uterus. So in the realm of thinking about ways things are absorbed, have you guys ever thought about doing that? Would that be useful? Would people absorb things? Would they absorb vitamins through the vagina in the way they do orally, or is that crazy?
Maybe certain vitamins would do.
That's why this is called uncensored. We talk about uncensored things.
Ryan's like, I definitely was not expecting to ask you if you take vitamins through your vagina.
No, this is normally the type of question that I ask, and I am not asking this one. It is all sweet little Southern girl from Tennessee.
I would be worried, since pH of the vagina matters so much.
Yeah, that's probably
about how it could affect
pH of the stomach and the pH of the vagina are probably not that far off, are they? I don't think.
No,
I don't
they're
know.
not.
Yeah, but I think you don't want. Yeah, I think the vagina's pH, I just think of as being more sensitive, that you can throw that off more easily, and you wouldn't want the vitamin. But
okay, maybe you should look into it, Ron. Maybe this is gonna be your next
thing. I have not thought of that before. It's a new one. I am a big fan though of vitamin IVs if you are deficient in certain nutrients, as a way to I don't do the blood work, don't do it ad hoc, but it could be a good way to from time to time boost certain nutrients if you are particularly deficient.
So I have a question. This is a very practical thing for anybody who's visiting with most reproductive endocrinologists in the United States. So I'll just throw this out there. So we do a crazy amount of testing. I'm going to be very honest. Most of the testing you're referring to, there is none of us doing that.
Mm-mm.
And so,
I mean, besides the vitamin D,
vitamin D, and honestly,
basics.
I don't even test for vitamin D. I just tell everybody to take it because I assume they're deficient. What is the practical way to kind of make this happen and to share this with our patients and for our listeners, with your friends? And so I mean, if you go to your REI and you're like, I want my selenium levels drawn, you're
They'll
going
look
to
at
get
you like you have two heads.
you're gonna
Yeah.
get this like blank look, like, yeah, no, you can take your vitamin. And then like, how do you maneuver this? Who should like we involve in this? Like, what's the best
Who
way to
does
make this
this?
happen if we're not, I mean, most reproductive endocrinologists are not naturopaths. I mean, we're just not.
No. So I think that's one of the areas of advocating for more of that nutritional education. The practitioners that do the most nutritional testing are naturopaths, functional medicine doctors, and then nutritionists, because I think they're the ones that are really heavily trained in nutrition and can interpret these panels. So outside of going to them, there are, some companies that are starting to make certain nutritional tests more accessible to the average consumer, like Everly Well is one of them. They don't have super complete panels. It's more like ad hoc. We are in process of hopefully offering a panel soon. The current nutritional panel that we like the most is from a company called Vibrant America, and we're partnering with them on a clinical study that will be launching this fall to look more comprehensively at perinatal nutritional status across supplements that women are taking. And they are increasingly offering basically the ability to order their test on direct to consumer off of certain practitioners' kind of website. So I can probably send you a couple links for you all to add into the show notes if that's interesting, if folks are curious about ordering those tests themselves. And then we are hoping to have a prenatal adjusted version on our site at some point in the future. A lot of the trickiness is they might order that test, but then you need a physician that can actually help you interpret it.
Well, you're probably going to need a nutritionist or somebody like that to help you interpret it, because I can say that in the times that somebody's brought something like that to me, I'm kind of like, okay, I can look at the red and I can look at the green and I can figure out where you need to be. But like, as you said,
area, how you can think about it too, in some ways, was just like, Sarah, Susan, how you're saying, I don't even test for vitamin D. I just assume you're deficient. So I put you on that. And in some ways, that was kind of how we designed our prenatal multivitamin, because we had enough test results across thousands of practitioners that we're working with to be able to anchor towards like, hey, baseline, this is going to be much more supportive than any prenatal you would otherwise be on, and safe enough that anyone can take it. There will be certain circumstances where I would say ours is kind of the most supportive prenatal out there, but there are circumstances if you want to get, more in depth and do a bunch of nutritional testing, you might tailor a few, like take more B6, take more magnesium, take more D. But that is really for like optimizers. That a lot of it can be grounded in general population and what is better than what exists right now.
Cool. Interesting. Nice. Thank you so much for all of your information.
Yeah.
It's very appreciative. And before I forget, and before people start clicking off, we have a code. And so go to the website, thisisneeded.com. And to get 20% off the first month of vitamins, put in the code FDU for Fertility Docs Uncensored, FDU. So go to thisisneeded.com and take a look. We appreciate the thoughtfulness, and we appreciate the science and the background that you
absolutely.
Because having reputable people is fantastic, especially for the things that we do every day, but don't really do every day. So
awesome. Well, it's an honor to be on. And then, if any of the listeners have any questions, we are happy. You can DM us at Needed on Instagram or hello@thisisneeded.com. And we have a team of folks who would love to talk prenatal nutrition.
Fantastic.
Awesome.
Thank you so
much. We may
much.
DM you too.
Please do.
Seriously. So to our audience, thank you so much for listening. Be sure to tune in next week for more. Reminder, we have the conference coming up on October 28th, 2023 in New Braunfels, Texas, between Austin and San Antonio. And so come to our website and take a look at registration. We would love to see you in person and are super excited about the thought of getting to meet everyone. Stop by Facebook, Instagram, and leave us a like and a follow and subscribe.
You can also visit fertilitydocsuncensored.com to submit specific questions you have about infertility. All questions will be answered on the podcast anonymously for our Ask the Doc segment, so don't hold back. We love episode ideas, so let us know what you're thinking and want to hear.
And as always, this podcast is intended for entertainment. It's not a substitute for medical advice from your own physician. All right, we'll be back soon. See ya.
Bye.
Bye.